Well, in health news, leading the nation, this is what Maine is doing once again with a new bill that's been signed into law. Our Alex Haskell is with us this morning with a deeper look at the state's new HIV medication access law and the impact it's expected to have on Mainers. And great news, Alex.
Yeah, Tori, good morning. State-regulated health insurance providers will soon be required to cover certain HIV prevention drugs with no out-of-pocket cost to patients. That's after Governor Mills signed the proposal into law earlier this month. Its supporters say Maine is only the third state in the country to have a law like it.
You know, everybody is very much aware that we are emerging from a pandemic. Fortunately, I think we're all ready for that, but we actually just passed the 40-year anniversary of an epidemic.
Matt Moonen is the executive director of Equality Maine. He's talking about the HIV/AIDS epidemic. Over those 40 years, according to UNAIDS, AIDS has killed nearly 35 million people. The new legislation is part of fighting the disease.
We are, of course, always excited about new ways to combat that epidemic.
Which is what an act to improve access to HIV prevention medications is expected to do. Senator Stacey Sanborn sponsored the law.
It's going to really reduce the barriers for folks who need access to PrEP and PEP medications, and it's going to save lives.
Medications for those at high risk for being exposed to HIV through sexual contact or injection drug use. CDC studies show they can lower someone's chances of getting HIV by 99%.
We need to make sure that everybody has access to them, even if they don't have a primary care doctor or they don't have health insurance.
Sanborn says the new law allows pharmacists to prescribe PrEP and PEP to people without a prescription. It requires state-regulated health insurance companies to then pay for the medicine.
And it's also going to help folks then find their way into a primary care doctor's office who can help make sure that they keep themselves safe.
So who will this new law affect most? Populations at greater risk of contracting HIV, which includes gay and bisexual men of all races and ethnicities.
As a former public health professional, I have spent my entire adult life.
Maine Senator Craig Hickman lived through the early years of the AIDS crisis,
working to eradicate HIV from our communities.
But Hickman lost many friends along the way to HIV/AIDS.
I laid down in the street to block traffic as a member of the organization ACT UP after burying 34 friends.
Now, one of the biggest barriers accessing PrEP has been cost. It can be thousands of dollars a month. Anyone across Maine can go to prep207.org or call 553-PrEP to get help accessing the medications. The law goes into effect 90 days after the Maine legislature adjourns, which Senator Sanborn says could happen tomorrow. Live in studio this morning, Alex Haskell, News Center, Maine.